Hello everyone, and welcome to the demo of the latest version of the One Heart Health. My name is Aaron Fogstead. I am the Executive Director, and I will be walking you through how to create an account, how to add a patient, record heart sounds, assign patients, complete assignments, review consultation details, and then a brief walkthrough of some of the updates in our settings and language features. To get started, when you download the app, this is the first screen that you'll see. You'll notice at the top right, you can see a language selection feature. We have lots of languages that we support with this app, and we can add even more. And so if you don't see a language that you prefer on here, give us a shout out and we will add it in a future release. So you can change the language settings right away. You can log in if you already have an account. If you don't have an account, you can click on New User Sign Up. And here you have two options. To sign up as an individual user, this means that you on your own want to use the app or test it out. This will not have access to our algorithms. Those are restricted to institution members because they are still in testing. And so if you do create an individual account, you will not have access to our algorithms. However, if you are an institution member, you can access those algorithms. It'll first prompt you to add your institution code, and then you can create your account. Now, if you don't have an institution registered with us, but you're interested in using our app and testing our algorithms, you can click the Interested in Adding Your Institution Contact Us button in the center of the screen here, and that'll bring you to a form. Complete the form and submit the request, and our team will get back to you. Now, I already have an account, so I'm going to go back to login screen and log in. Here we have our test, and we're going to click login. Now this brings us to our main page, which is the active patients. So these are active patients within my institution. And so we can browse this patient list. We can filter and sort by name, ID, birthday, or created at date. So this then structures it by when that patient was created. And a couple of things you'll notice are the name of the patient, a triage status, whether it's CHD suspected, pending, or we might even see normal. And then finally, that green indicator on the right is the pathologic murmur probability score, and we'll get more into that. Now, looking at the bottom of the screen, you'll see our navigation. You can navigate between patients, assignments, consultations, and profile. We're going to stay on patients for now, and we're going to go through the full flow and add a new patient. So for this patient, we're going to give the first name of test and last name of demo. We're going to assign male as the gender. We're going to assign a date of birth. We can add the phone number and email. We'll skip that for the demo. We're going to add a height. We're going to add a weight. This is a very disproportionate patient. We will have the SaO2 for hands and for foot, and then any additional notes. This is the information that the app collects as our standard new patient details. We'll click submit, and now that patient has been created. And here we have it, test demo. Now we can view this patient. We can see the note that we added. We can see those patient details. We can look at any heart recordings. There have been no recordings yet, so that's grayed out. We can look at triage status, consultations, echocardiogram findings, and any surgical interventional outcomes. We'll get more into those later, but for now, let's record a heart sound. So to do this, I'm going to plug in my digital stethoscope. Here we can see the preview screen and our site, the lower left sternal border. Now we've completed the 10-second recording. We'll hit save, and it'll move us to the middle left sternal border. Now we've completed the middle left sternal border. Typically, we would record 5 heart sound sites. but for the demo purpose, we're just going to upload two. Here we have our quality algorithm that is running on the heart sounds that we recorded, and it will analyze and determine the quality. And it says both are high. Okay, and now we've recorded 2 heart sites. Typically we record 5 sites. For this demo purpose, we're just going to record 2 just to keep it brief. Now when we click on view heart sounds, we can see the output of our first algorithm, which is a quality score. So that shows us whether the heart sound quality that we recorded was low, medium, or high. We of course want the highest quality heart sounds recorded, because then once we have those recorded and uploaded, our murmur analysis algorithm is triggered. So we will just give it a minute for that murmur analysis algorithm to run. In the meantime, we can view the recordings. So here we have the phonocardiogram. So this is the view of what we just recorded. We can play back the sound. And we can view each one. So here in the bottom left, we can see which site it is, what the actual file name is. This is helpful if you download the file itself and want to validate which one. And we'll go back. All right, and now we can see the output of our pathologic murmur probability score. And it's showing 35%, which is a low probability for a pathologic murmur being present. This is our probability scale, just for more information and additional details on understanding the probability score and its output. Just as a reminder, this is not a diagnosis, and this is still in testing. Okay, so from here, we will go back. And now that we have our recorded heart sounds, our notes, and the patient details, we can think through what we want to assign this patient's triage status as. Whether we think it's normal, the patient, which selecting normal will indicate that the patient should be archived and that they are healthy, or CHD suspected. For the purpose of this demo, let's select CHD suspected first. When we select CHD suspected, it'll ask to confirm the triage. We'll select OK, and then it'll prompt us to assign to a pediatric cardiologist. In this case, we're going to assign it to ourself, Dr. Demo Test. Now that we have assigned this patient, we can view that patient in our assignments queue. And so this is to help when we think through our workflow. If you are a healthcare worker in a rural setting and the closest pediatric cardiologist is hundreds of miles away, and you want to verify whether a child suspected pathologic murmur, or murmur in this case, without being confirmed, is a pathologic murmur, you can record that data and send it to that pediatric cardiologist. That pediatric cardiologist can view their assignment queue, select the patient, see the patient details that you collected, view the heart sound recordings, play back those recordings, view the pathologic murmur probability score, and then complete their consultation. In this case, we are going to say, based on our analysis of the heart sound sites, the heart sound files and recordings, and the pathologic murmur probability score, we're going to say this patient is normal and complete our assignment. Now that that assignment has been completed, you can view it in the consultations queue. And we see that consultation as normal. Now for this patient, when we go back to that healthcare worker, we're going to change the triage status now that we have that consultation added to normal. And this will archive that patient. Now if we go back and we select our archive patients, that patient will appear in that list. If this patient did have an echo, we could add an echo findings report, and we could say, in this case, normal, let's say no, and we'll have that confirmation. Furthermore, if any surgical or intervention takes place, those outcomes can also be added in a note field to track the entire patient's care journey. That is the full flow of adding a patient, assigning that patient, completing an assignment, and viewing that patient's consultation. To wrap up, let's review just some of the settings. By clicking on the Profile tab, you can see your name, email information, institution, and edit those details if needed. By clicking the gear in the top right of the screen, you can go to our Settings field, which allows you to view language, select a different language, a manual sync option, and information on the local database showing how many patients are in your institution, how many records, how many healthcare workers are part of your institution, and how many consultations and messages have been provided. You can attempt a manual sync if you think your data is not syncing by clicking the green Sync Now button, and that will trigger the local database to sync with our cloud database. We also have our privacy policy and a feature to report a bug. That is the full demo of the OneHeart app. Thanks for sticking with us.